Welcome to yet another one of Princeton's Parent Community Educational Series. We certainly appreciate all the panelists that are here tonight. We're going to learn a lot about our school-based health center. Now, this is something we've had in our district for quite some years. We have a great partnership with Health Connections in Lincoln Heights, and really certainly appreciate Barbara Bailey for her leadership, the great Dolores Lindsay, who's recently retired, and our new CEO, who couldn't be with us tonight, but Barbara's going to carry the torch. And so we really appreciate you guys being here. So we're going to learn a lot about the school-based health center. We're also, very importantly, we're going to learn a little bit more about vaccinations and how that can impact positively our entire population, but specifically the students at Princeton that qualify ages 16 and up. So with that being said, just want to remind the community, our educational community, that students in the high school would have received an interest survey today. So parents, guardians, uncles, aunts, grandma, grandpas, please make sure that you remind your sons and daughters, grandchildren, and so forth, to open up the email and complete that interest survey. We're going to do our very best to help smash and end this pandemic as quickly as you possibly can. So we have great medical partners, panelists that are here today. We have residents, we have district staff. So without further ado, we're going to get going and really, again, appreciate the great partnership that exists for our school-based health center and our great partnership with Mercy Health and all the providers that are here today. And thank you for Dr. Mary Phillips, Dr. Jameson, Chris Lockhart, Trisha Roddy being here, helping carry the torch again with Princeton City Schools. And just as one other reminder, you know, we're very proud to have a mission statement that we feel is very strong, that we live each and every day, and that is simply empowering each student for college, career, and life success. That's what tonight's about. It's about empowering and it's about learning. So without further ado, I'm going to turn it over. Thank you. So we are going to start off with the school-based health center. So Barbara, do you want to lead us in this?
Actually, yes, I do. I'd like to introduce Elena. Elena Roach is our pediatric nurse practitioner at the Viking School-Based Health Center, which is one of the arms of the Healthcare Connection. Elena will introduce herself and start off with what is a school-based health center.
Yeah, hi there. So Elena Roach, I'm the nurse practitioner in the school-based health center. As Barbara mentioned, I do work for the Healthcare Connection, and we do have space that's located inside Viking Village. We're serving the students of Princeton City School District, so not just high school, middle school, but also the elementary schools. Our role there is to make sure that the children in the school district are healthy and ready to learn. Some of the services we offer are so primary care services, so well child checks, dental screenings, vision screening, hearing screening. We do offer primary care services in terms of we can be a primary care provider. However, it's not our goal to take patients away from their own primary care provider. So if there's a child that needs, say, a sports physical or needs an acute care visit, for instance, sore throat or these days COVID testing, stomach aches, headaches, that's definitely something that we can see in the school-based health clinic. And those kind of things, if somebody has a primary care provider, we will communicate our visit with the primary care provider so that there's continuation of care for that student. We do also offer vaccines for children. So any school vaccines and then any of the recommended vaccines per the American Academy of Pediatrics, we have those in the school-based health clinic. So I see up from birth to 19 years old. So if they're over 19, they're out of my range, but I can see birth to 19. And so some of the questions I get asked frequently is, what is the school-based health clinic? And I just answered that. We're a clinic that works alongside the school to make sure that these kids in the district are healthy and prepared to learn. Again, we can see any of the students who are Princeton City School District services provided. I talked about that. Barbara, you want to handle the insurance?
Sure. Before we leave, who can be seen? We recently added siblings to the population that we see as well. And then as far as the consent form goes, the consent is good through the span of the students' enrollment in the district. So we don't have to, like we do in our other health our outside health centers, we don't have to have those consent forms signed annually. As long as the student is active in the Princeton City School District, it's good for us. And those consents are signed, and the parents are able to have their kids treated without them being there, which can be a great assistance. And there, right now, they call this grant season. So we are planning to expand our school-based health center there with dental. So at a health center or a school-based health center coming near you will be dental services in the Viking Village. As far as what kind of insurance is accepted and how do you pay, most insurances are accepted by our organization, but there are a lot of students who are ineligible or ineligible for insurance. For those students, we have a sliding fee scale that is based on the number of occupants in the home and who the head of household is. So it's based on income, and you have to show us proof of income as well as the number of folks in the home. It will go down as far as $25 for the flat fee for the visit, and I believe that those numbers have to be resubmitted annually. So with the insurance, there's a number there for folks to call to see if we accept yours, but most insurances are accepted. We also, like I said, have the sliding fee scale. For parents who only want vaccine, we have every Wednesday vaccine clinic at Lincoln Heights. We are getting ready to rev that up again after the pandemic. That walk-in clinic had been put on hold. That clinic will allow anyone, established or non-established, to come in to get childhood vaccines. Lots of the private physician offices don't carry the vaccines, and we do for vaccine for children. So your insurance will pay for it, or if you are uninsured, there is a flat fee, and then it is $5 for each vaccine. So any questions you might have, and that has been unchanged since we've been in the school. So what's happening right now, save the date, April the 24th, 2021, from noon to 3 o'clock at our Lincoln Heights location, we are offering 150 Pfizer COVID-19 vaccines for the kids that are 16 to 17 years old. We ask you call for an appointment because right when we hit 150, we will extend the number of vaccines that we have to increase that number and the visits that day. What we want to make sure is, I'm sure you've heard on the news that the demand right now is less than the supply. Go figure, that's the first time this has happened. And because the vaccine, at least Pfizer, has to be reconstituted, we want to make sure that we don't waste any doses. We think that each vaccine is actually alive. What we do for anyone over the age of 18, they will receive the Moderna vaccine. So if any other kids come over the age of 17, or even their parents, we will make way to allow them to receive the Moderna. We are now having vaccines at all of our, at both two of our health centers, but at Lincoln Heights, we are 8 to 5:30 and to 7 o'clock on Thursday for Moderna. And all you do is make an appointment and we will get you out of there in much less time than one would spend at one of the big pop-ups downtown. So once again, save the date. And for forms for the school-based health center, here's the website for the connection to receive all of those forms that are required for anyone, any parent to sign their kid up, or in any school in the district to sign their kid up to be seen at the school-based health center.
All right, so hi everybody. So happy to join you guys here today. My name is Dr. Ebo. I am a current pediatric resident at Cincinnati Children's Medical Center. I'm here with some of my other colleagues, and we just wanted to take some time to talk to you all and answer some of the most common questions we've heard regarding the COVID vaccine and the kind of precautions surrounding that. So we'll take some time to answer those questions, and then if you have any other questions, please feel free to ask them. Next slide. So, is it safe to return to school in person? This is a great question. The CDC recently published some data actually that shows about 3 feet of separation is as good as 6 feet. Those data can be very helpful for the school as it can have more people safely attend. So that's something that's really good data to know that's been helpful for knowing whether we can integrate back into schools or not. Next slide.
Dr. Ebo, if I may, I'm sorry if I could just jump right in.
Yeah.
That's a big question that's been in our district, that's actually permeated our district, was the 6 feet versus 3 feet. Mm-hmm. Now, when the CDC first released this, we jumped all over this and we talked to everybody and we said, you know, we're going to be able to bring everybody back. And we have, and thus far it's been wildly successful. Mm-hmm. But can you talk, and I'll put you on the spot here, sorry. Can you talk specifically about like how come an order hasn't been given, or how come there hasn't been kind of a relief on the 6 feet? Because you're still talking about 6 feet social distancing versus 3 feet. Can you talk a little bit about that? I'm sorry, and then move on, because this is something, again, that our parents want to know.
Sure. I actually might have one of my colleagues, Dr. Frenck, who's on the line. I might have him actually answer this question. He's one of our COVID specialists here.
Hi, I'm Bob Frenck. I'm one of the pediatric infectious disease physicians at Cincinnati Children's, and that so I'm not sure what you're saying as far as in change the recommendation. I mean, I think that what they've come out and said, as far as that the CDC said that, and it comes from data showing from a couple different school districts that the transmission rate is no difference between 3 and 6 feet. If I'm not sure, are you asking like the White House changing policy, or where are you asking?
Specifically the state as their recommendation for social distancing. And Dr. Frenck, we took part in that study, actually one of the studies in Ohio that actually showed the differential or the lack thereof between 6 feet versus 3 feet. So anything you could talk about, that'd be great.
So, I mean, one of the issues is that there's been what's been a federal policy. So CDC is a federal organization, and they're going to give recommendations from the Centers for Disease Control. And then the state health departments channel up to the CDC, but they're really independent of the CDC. So they can have recommendations that are a little bit different, and that can sometimes be a little bit confusing. I think it's the intent is as much as possible to try to harmonize and that sometimes it takes a little bit of time for recommendations to change. I can tell you that's what the CDC's policy, I think, is looked at the 3 feet. You know, if you go back and look at where this initially started, 3 feet is what was initially said. And then what happened is that people that were experts in transmission and modeling and that, and started doing computer programming, said, well, maybe it's possible that the virus could go further. And so rather than getting into arguments about how far could the virus go, people kind of threw in the towel and said, let's just make it 6 feet, and that it'll be safer that way. Now that we have data, again, I think it really allows us to go back to the 3 feet, sir. And you know, but as far as when Ohio may say it, I don't know. I can tell you that I've talked with other schools, and they've had, so the Cincinnati Public School District has had similar concerns. I think they did transfer back to 3 feet. I won't swear to it, but I think they did. But there has been a lot of discussion about that. You're right.
Thank you very much.
I wish I could be more definitive, but that's kind of about the best, that there still can be a bit of a separation between the policies of the two organizations, although hopefully they'll be harmonizing as much as they can.
Yeah, but that's very helpful. We've had question and answer sessions left and right with not only our staff, but our community. And this is something that's come up multiple times. And so there's great concern about that. But I think now, almost 3 weeks into our transition back, people have seen that we've been able to do so safely.
Right.
So that was very, very helpful, believe it or not, Dr. Frenck. You may not think so, but it was just because you're the expert and you see kind of some of the same things that we're seeing right now with perhaps inconsistency, or as you put it, not harmonizing.
Yes, I think everybody intends to do as best they can. I go by the idea that everybody goes to work to do the best job they can, and sometimes there's impediments, and that we just need to get around some of those impediments. So, Dr. Evo, you want to go?
Yeah, absolutely. So the next question we've seen a lot is, what can we do to decrease the risk of transmission? And so one of the things that we've been striving to do is mask wearing, right? Masks by themselves have been shown to be 85% effective in decreasing transmission. Frequent hand washing, also tied with appropriate social distancing, have been about the same. So while we don't have data on the actual combination of everything, it can't be less than 85%, or most likely higher, to help decrease that risk of transmission. Next slide. When will vaccines become available for kids? So currently, as many of you have heard, children 16 years and older are able to receive only the Pfizer vaccine. This age was chosen in the initial trial, so we know it's safe and effective in this age group. Within the next couple of weeks, hopefully we'll be hearing more about them being able to drop the age back down to 12 years old as more data comes out. So stay tuned for that.
All right. So my name is Ellen Pittman. I'm another one of the resident doctors from Cincinnati Children's, and I'll kind of take over here. So, we talk about why do we need to vaccinate kids? I think there's been a lot of question about, what does COVID look like in children, and, what's the risk benefit about vaccination? Ultimately, this is sort of a two-part answer. The first being that, COVID still certainly poses risk to our pediatric population. There have been over 300 deaths in the United States from COVID, comparing that to annually about 100 to 150 from the yearly flu. Certainly we would estimate that there's been about 3 million infections in children. So it's certainly, prevalent there. And so getting our kids vaccinated can help them mitigate that risk. The other piece of that is that when children are vaccinated, that can help us, keep our whole population safe, keep your family safe, thinking about, relatives that may be at risk or who are elderly, things like that. Vaccinating them helps or vaccinating the children helps those family members as well. Children are very good at spreading respiratory illnesses, and COVID is no different. And so that's why it's important that children be vaccinated when it's safe for them to do so. We hear this one a lot. We've heard this from our patients and our families, certainly, are the vaccines safe and were they made so quickly? I think the context of the development of these vaccines is certainly, as we all remember, just a big push to get a vaccine available as our country was really, struggling with this pandemic. But it's really important to remember and for us to communicate as, healthcare providers that no steps were skipped along the way in these trials, and they were truly quite robust. There were at least 30,000 people enrolled in the trials for each of these vaccines. So, that's really quite an impressive number when we think about, testing vaccines, and certainly appropriate numbers to be tested on. And so we feel confident in saying that these vaccines are safe and effective because those trials were done so well. The next slide. This is another question that we hear a lot about. Are there any long-term risks about getting the COVID-19 vaccine? What we know about the vaccine and how it works, this mRNA vaccine, the idea is that we're showing our body the instructions for how to make a protein that your body would see anyway if it were to get a COVID infection, itself. So either way, we're helping our body to make those antibodies against that spike protein. With the vaccination, you don't have to get the illness to make them. Once your body sees those instructions, that mRNA is quickly degraded in the body and doesn't stay around. And so we really don't anticipate any big long-term risks from the vaccination. And I would, compare that to what we're continuing to see as some of the lingering effects of an actual COVID infection, which are proving to be, that they can be quite long-lasting and sometimes severe. So our risk benefit here, really is in favor of getting vaccinated.
All right, and I'm gonna finish off these last couple questions. My name is Erin McCann. I'm one of the resident doctors at Cincinnati Children's as well. So this question, do we still need to wear masks even after we get vaccinated? So we would definitely still say yes, that everybody should be wearing a mask. Eventually, hopefully this will be able to lighten that guideline. But for now, as we're still trying to get more and more people vaccinated and protect, the children, and as well as people that are at higher risk, we certainly need to continue wearing our masks still. And so I know that you guys already talked a little bit about the incredible vaccination clinic that you all are going to be having on the 24th of this month. Barbara mentioned that through the Healthcare Connection, which is an incredible opportunity. And then there's a couple other resources if for some reason you are not able to make that appointment, that we just wanted to point you all toward as well. So if your child or you are 16 or older, there's a couple different avenues you can go through to try and get signed up for a vaccine. So one would be the Ohio Department of Health website. This is a QR code that you can just scan on your phone and it'll take you directly there. It kind of walks you through, asks you how old you are, kind of figures out where you live and kind of goes through that way. Another option is an application that you can download to your mobile phone called Armorvax. If the internet option is not as feasible, you can also call United Way. You just dial in 211 and they will help you based on where you live. They can help find resources if you need help with transportation, all sorts of things that they're able to provide. And this last QR code is also directing you towards the Cincinnati Children's vaccine website. It talks about COVID vaccines, but it also talks about all of the vaccines, all the childhood vaccines in general. So if you have more questions after this presentation, or if there's something else you want to learn more about, then we would happily direct you there. And it's a pretty robust site that has information written as well as some videos to try and help explain some of these questions.
And so today, a parent survey was sent out to our high school students about your interest. So if you do have an interest in getting the vaccination, or if you don't, if you are a parent of a 16 to 18-year-old, if you could let us know, that way we can make sure that we use our doses wisely and effectively.
I'd also like to share that, as Tricia said, the interest survey is going to be going out, and we want parents to be able to indicate if they're interested in having their child to take to be given the vaccination. And we want to be able to give it on site. So we partnered with Mercy Health for our staff when our staff receive their vaccinations. And so we want to do the same thing for students as well, and have Mercy Health to partner with us. Barbara mentioned that Lincoln Heights Health Connection is doing vaccinations for adolescents as well. And that is on April 24th. It is open to the community. It's open to students who are interested. Obviously, they'd have to make an appointment as well. But we'd like to be able to do something within the school setting, so that, you know, we know many of our families, our students are going off to college. And we know that some of the colleges are requiring students to be vaccinated before they return. So we want to be able to support that area as well. But we also know that, you know, it's important that we all get vaccinated. So as Ms. Roddy said, the interest survey is going to be coming out. We're going to see how many parents are interested in having their students to be vaccinated. And once we get that information back, we're asking for our parents to respond to that by Monday, April the 19th. Once we get that back and we analyze the data, then we will send out more detailed information on the process, and give them information about the Pfizer vaccine, et cetera. So that's the plan that we have in place. So hopefully parents who are listening tonight will complete the interest survey and get it back to us as quickly as possible. I do have a question, I think that wasn't asked. If I'm a young lady and I'm healthy, I never get sick, why should I get the vaccine?
So this is Bob Frenck. I would say the likelihood of getting serious infection is higher as we get, shall we say it, more mature. But that is not zero, even as a child. And as my colleagues were saying, is that we've had over 300 children under 18 years of age who are perfectly normal, healthy kids that have died already in the United States from COVID. And the last I checked, it was 14,500 kids that have been hospitalized for COVID in the United States. So it's not benign. If you put it in context with meningococcus, which we get people to get vaccinated, every child vaccinated, that's a disease of 1 in a million. There's about 200 cases in the whole United States every year. If you put it in context with flu, we're having 3 to 4 times the number of children that have died from COVID that have died from flu. And then as we're getting older, we're having a higher risk. But, you know, while it's still low, we've had people in their 20s, 30s, 40s that are very healthy primal life that have died from this virus. And the problem is I can't tell you who's going to be the one that's going to get sick. If I had some marker to be able to draw a blood test and say, okay, Ms. Phillips, you're the one that's going to be at high risk. I really need to make sure that we've vaccinated you. That would be great, but I don't have that. And so that's really why I'm needing to protect everyone. And then as was mentioned too, the vaccine not only protects you, it's hoping to try to keep you from spreading to anybody else. And there was a really nice article that was published in New England Journal of Medicine in January from Israel, where they showed the Pfizer vaccine decreased transmission, decreased spread from person to person by over 90%. So not only that it had the protection for that individual of decreasing disease by 90+%, it decreased you giving it to anybody else by about the same. And so those are really the two reasons, is that to try to get it. And the other, did need to get the vaccine. And the other thing, as far as, you know, for kids, is that there's over 75 million people in the United States under 18 years of age. And so that's about 14 to 16% of the population. If we don't immunize children, we're going to have a very large percentage of the population that are going to be susceptible to the virus and be passing it on. So those really are the reasons we need to do it. So that we can get back to normal. I'm not going to say the new normal. I refuse to say that. And that to get back to normal, to be able to go back to social gatherings, to be able to go back to churches, to movie theaters, to museums, to restaurants, you know, to travel, I mean, this has been a really rough year for people. And this, I think the vaccine is the way for us to get back to normal.
Thank you very much.
Okay. So I apologize, Mr. Burton. I just have to run for another call, but if I can help in the future, just let me know. I'd be happy to.
Thank you.
Definitely, thank you. And because of the format, we have not yet had a chance to hear from Dr. Irani. So I wanted to know if you had something that you've observed or an answer to one of the questions that you would like to lend to the dialogue and the conversation.
Thank you very much, Chris. Farzan Irani. I'm an internist, a hospitalist at Mercy Health. I'm also the Vice President of Medical Affairs, and I thank you all for having me as a part of this important conversation. I think going back to Ms. Phillips, why would someone young and healthy need the vaccine? As Dr. Frenck mentioned, I mean, if we have to get to any normalcy, the only way is to break this cycle of spread. And that can only be done if every one of us is vaccinated, old, young, child, adult, doesn't matter. In the last few weeks, we've heard more about variants increasing, the UK variant, the South African variant. Everyone who is not vaccinated potentially serves as a host for getting infected and for increasing these variants, which in the future can pose greater problems. That's why it's imperative that we as a collective kind of take on this responsibility of getting vaccinated. Also, as far as the safety of the vaccine, I mean, we have vaccinated, at least at Mercy Fairfield and Mercy Health, thousands of folks. And we have seen that not only in clinical trials, which have been pretty robust, where there are 40,000 participants, but in real life, we have vaccinated so many adults ranging from 80 years and down. And we have found it to be pretty safe and actually very, very effective. And as we move down, it is the younger folks who are not vaccinated and who pose the highest risk of spreading this vaccine. So it becomes even more important to focus on that age group.
I had a question regarding the types of vaccines. You know, there's a lot of information in the news related to Pfizer, Moderna, and Johnson & Johnson. So Dr. Irani, do you have any particular thoughts if someone's concerned about which particular vaccine they should go for?
My recommendation is if you have a vaccine, get it. If you have a choice, then maybe kind of think about it, but all vaccines are the same. They do exactly the same job. For everybody above 18 years of age, you have the choice between the Moderna, the Pfizer, and now the Janssen vaccine. But for ages 16 to 18, we only have the Pfizer vaccine, which is currently approved for that. But yes, if you have a vaccine, just get it, irrespective of which one it is.
Thank you.
Very good. Now, one of the other questions, maybe whoever can jump in and share as far as the statistics, just a little bit of data about the safety of the vaccines. I know there's news today about Johnson & Johnson's vaccine, and I know there's some other unsubstantiated issues about the vaccine. So if you could just give us some research-based information about the safety of the vaccines. And again, anyone that has that information, just feel free to jump in.
So I do not have the exact data in terms of numbers, but these vaccines are very safe. Yes, we have seen some mild local reactions, such as soreness in the arm. Some folks do experience some fatigue, some weakness, maybe a fever, something resembling a mild infection, but we've seen it last for less than 12 hours, nothing that our regular over-the-counter medications cannot take care of. So those are the most common reactions that we're seeing. They're probably that younger folks, just where their immune mechanism is constituted, tend to have a much more robust immune response to the vaccine. But nonetheless, we've seen all these reactions be very mild and something resembling a very, very mild illness. We haven't seen many severe reactions, but again, I don't have exact numbers on that.
Okay, very good.
I have one question for Tricia. Tricia, when you get your results back from the parents and they tell you whether or not they would like their child to be vaccinated, could we, I think the statistics will be pretty telling. The younger we've gotten, when we were at 80 to say 55 or 65, it was, we had a 1,500 person waiting list. As soon as we got below 50s, the numbers dropped off dramatically, as well as the no-show rates. So we kind of probably extrapolated that a lot of the parents of these 16 and 17-year-olds will fall into that 50 and younger group. And we think perhaps that since they are quote unquote waiting, and we ask them for reasons as to why they are not getting the vaccine, and they just say we're waiting. So it would be pretty telling to see what percentage of students of the age group that's qualified or eligible, what these 50, 45-year-old parents are stating. And we thought about having focus groups, but we kind of figured they're telling us we're just waiting. So one young lady told me, well, you haven't turned into a zombie yet, Barbara, so I guess that I will go on and take the vaccine. So she did. I had a nurse who applied to be one of our RNs to give the vaccine, who works in a nursing home. And I told her when she applied, I'm like, I can't hire you if you haven't had the vaccine. You have to be able to tell a story. After our interview, she did take her first dose. So I think those stats will give us lots of information.
For sure, we will definitely share that information, and that is going to help us determine what we can provide as well. So.
And I would just say, if parents have more concerns about some of the data or other questions that we're not able to answer today, even if your child maybe isn't eligible yet to get the vaccine, it is totally fair game to ask your pediatricians, your family doctors, the nurse practitioners in the schools, ask these questions. And if we don't know the answer right away, we certainly will look up that information and get back to you. But I think it's really important that that we are open and honest with all of the news and data that we have. And so we encourage you to ask questions, and we want it to be, you know, an open dialogue so we can kind of help with any concerns that there might be.
Yes, thank you. Yeah, because I know, you know, since we're actually recording this today on April 13th, that's going to be the elephant in the room for a lot of people, is the Johnson & Johnson news. And because of just what you're saying, there's already a fall off for those younger age groups. You know, I think it's important that we provide information about, you know, when those of us that deal with statistics, the risk and the reward, in a realistic view of, you know, what's the risk? Well, we heard just in this session tonight that you have a greater risk of catching COVID than you do the flu and having very ill effects of it. And again, I don't think a lot of people know and understand that. So what's the risk and the reward of not getting the vaccine, you know, and taking that chance with your own or your loved ones' lives, versus the risk and reward of taking the vaccine? And what are the realistic statistics of any ill effects, let alone, you know, any large or life-altering ill effects, which again, from my understanding, are very minimum. So that's why I asked that question, and that's why I thank you all for your participation tonight in spreading this information about trying to limit this virus and get out the real information. We've got about 5 minutes left. Trish has her hands up, and so we're going to go to Trish.
I have some questions from parents. The first one is, I have a question about, will students, if they get their vaccine at school, will they go home right away, or will they go right back to class?
That question would be, it's based upon what the parent wants. There are a number of schools that have actually given the vaccine in school, and a lot of the students will go to the clinic, get their vaccine, and then get their vaccination, and then return. But obviously, if there are parents who have some concerns about that, they can be a part of that appointment. They can come in and go with their child to the clinic, get the vaccination, and then take them home. So yeah, that's not a problem.
And then also from a parent, and this is probably directed to our doctors, are there any stats about how many youth have been vaccinated, either locally or regionally or nationally?
I do not have the stats of our local vaccination rate off the top of my head, but we could certainly get that to you and let you include it in the posting with this video and everything. We could get that to you later this evening.
Thank you.
I want to give a shout out to the school-based health center, because this is actually the first time that we've had this kind of communication to parents in this format. And we've had the school-based health center in our high school and middle school for probably the last 7-8 years. And so it is definitely used by many of our families. The consent form is available for parents to sign. If their student is sick, they go to the school nurse, our school nurse, and if there are some other concerns, the school nurse would then refer them to the school-based health center, and the nurse practitioner could then diagnose, call in a prescription, and do those kinds of things. And so it makes it easier for the family, because then student goes home, parent drops off on her way home from work, gets the prescription, kid takes the prescription, and he or she's back to school quickly. So it's definitely a great service, and we want to be able to make sure that parents are aware that the service is there. As I said, we have the school-based health center for quite a long time, and we have a nice percentage of families who are using it. but we always want more because
Right.
as someone said, healthy, you know, if you have healthy children,
healthy mind.
Absolutely.
Right.
I just wanted to I wanted to share that information because, you know.
Thank
and
you,
then
Erin.
let that parent know too. Let that parent know that once anyone gets the vaccine, depending on there's an assessment that takes place. If there are allergies or something in the background, then they will wait 30 minutes after the vaccine. If not, they were watched for 15 minutes before they are able to leave any environment, whether they go home or back to class, just to make sure that there aren't any immediate side effects.
Yeah, thank you, Mary.
Right.
The only other thing I would add is, you know, just thanks to everyone for your participation in the panel today and just thinking about our student population and how diverse our students and families are. Just wanted to see if there was information that's available in other languages besides English that could be included in some of the frequently asked questions, because we'll want to be sure that our families whose first language is not English will be able to kind of access the same information. So that would be helpful as well.
Kevin, are you speaking in regards to the school-based health clinic or the COVID vaccine information?
The school-based health center information that either Mercy or Cincinnati Children's can share that, you know, we can include when we push out information to families.
Definitely. School-based health center, we do have, I do have a Spanish speaking interpreter, and we have access to a language line with, I want to say, at least 6 languages. All of them we've been able to use so we have families that speak Uzbek or Russian, Turkish. Those are the ones that come to mind most recently. And so, yes, we do have interpreter services available. And I try information as I can in those languages, you know, if I'm giving out print materials.
And I will try and get some material in different languages, which helps get this vaccine information out. And I'll get that to you.
That's terrific. I have another question from a parent. Should a student who had COVID and was positive for COVID get the vaccine?
Yes, you can still get it. Even if you had COVID, there really aren't hard restrictions on really the timeline or anything like that. It certainly is not a reason to stray away from the vaccine. You still want to be protected and keep yourself from spreading COVID to other people as well. So certainly, yes, we would still recommend it.
Well, this has been informative and exciting. You know, not only I know the focus has been particularly for our students that are currently eligible for the vaccine, but again, I think this type of information is vital for our community to hear from the medical experts and the persons that are working day to day with this about what the vaccine is, its effectiveness, and the data that's driving the initiative to get as many Americans vaccinated as possible. We are a little past our time, but it's okay. We're not broadcast TV, so we don't have any heartbreaks that we have to deal with, and this will be available online. So because we don't have any heartbreaks, we're going to make a little audible here and give each of you a chance to have one last thought or comment before we break. We're just going to go in any order for anyone that wants to have one more statement before we end this parent session.
I can go. Elena Roach. I just want to thank you guys for organizing this. This is really a neat experience, and happy that Princeton has such big outreach to their families and the availability. So thank you guys for organizing this and giving us the opportunity to talk about the school-based health center, and just really good information about and good questions about the COVID vaccine. So I'm happy to answer those too if parents have more questions. Would love to chat with parents. So please give us a call.
Very good. Anyone else?
Yeah, Ellen, Dr. Pittman from Cincinnati Children's. Again, just want to say thank you so much for having us and helping us to answer some of these questions that we know we're hearing so much from our patients and our families. And just to echo what many people have said tonight, this is a changing field, and we're learning more information, and we're hopeful that the vaccine will be approved for children as young as 12 here soon. And so keep looking for more information to be coming out about that. And please don't hesitate to reach out to your child's pediatrician or family doctor or the wonderful school-based clinic. If you do have questions as this goes on, we want you to have those questions be answered and feel comfortable with the decisions that you're making for yourself and your family.
Very good. Any others?
This is Farzan Irani. I just wanted to thank you all for organizing this, and thank you for allowing me and Mercy Health to participate in it. I think this has been extremely informative for our parents and their children to kind of know what's going on with the vaccine. I think we've made a lot of progress in our fight against COVID. I think we're almost there. It's just a few more steps. This is not the time to let our guards down. There's a lot of information out there, good information out there on CDC websites about the vaccines. So please read, please talk to your healthcare providers. And I would strongly recommend everybody get a vaccine. So thank you once again.
I'd like to just thank everyone as well. This has been very, I think it was a great, 45 minutes, 50 minutes, 50-minute session. One of the things that we had talked about was just making sure that our parents had enough information to be able to make an informed decision, particularly when we send out the survey. And I think that we have met our goal, Tricia. I really do, and Dr. Jameson and Chris, I really think that we've met our goals. So I do really appreciate you all taking time out of your busy schedule to be here tonight. And I do want to throw one more thing out for School-Based Health Center. They are going to be available this summer as well, because we're going to have a robust summer school. And so the School-Based Health Center will be open this summer as well. So thank you.
Thank you, Dr. Phillips.
All right. And I'm going to share that contact information for the school-based. That's not the correct one. Hold on a second here. But again, if anybody else has any other, I don't know why it's going to that instead of to the, there it is.
Great.
Any other comments? You will appear on the screen as we get ready to wrap this up.
I just want to thank everyone who's joined us this evening to either learn more, but also participate in this panel. And I think the key is just continuing the conversation as we head into the end of this school year, which has been quite a different school year compared to previous school years, but then also the summer into the fall. I believe that this type of collaboration and communication will continue to be important and necessary until we reach our goals around being able to get back to normal. So thank you.
I just wanted to add that we will be broadcasting this in Spanish as well. Ana Martinez, our bilingual parent liaison, will go through the slides and make everything in Spanish so that we can, and translate also the dialogue so that we can share that out as well. And if our Princeton members can unmute for a moment and join me, because as always, go Vikes! Good night, everyone. Thank you. Thank you.
Thanks.
Thank you so much.
Thank you guys.